Next, we're going to demonstrate some tests to look for the stability of the shoulder. The easiest and most common is the so-called apprehension test. What you do is you bring the arm up into a 90-degree position here, and then you rotate the arm back. And this is a position of instability. If they have an unstable shoulder, they will have pain as you do this, the so-called apprehension. You can accentuate this by adding a force posteriorly. So at this point I'm pressing on the patient's humeral head and pushing the humeral head anteriorly. That will accentuate it. You can also relieve that sense of instability if you support the patient's humeral head anteriorly, and if they have a relief of symptoms, then that would again be suggested that they may have some instability. Another test for instability is the so-called Sulcus Side. To do this, you pull down on the humerus and look for an indentation on the lateral side of the shoulder. This would indicate that there is an inferior instability. Another way to examine for stability of the shoulder is to have the patient in the supine position, and you steady the shoulder girdle, then you grab the humeral head and you rock the humerus and humeral head forward and backward, looking for any instability. And to do this maneuver, you want to compare both sides to see if one side has more movement than the other. On the side that you have the excessive movement, you would be concerned about instability. One of the problems that can occur with instability of the shoulder is to have a labrum tear. And so to examine for the labrum tear, there's several tests that can be done. First is to use the humeral head as a probe to push against the rim of the labrum. So you grab the elbow and you direct the humeral head superiorly, and you push against the labral rim to see if that causes any discomfort. Another way to evaluate the labrum is with so-called O'Brien's test, where you bring the arm across the chest and put the patient with the thumb down position, and then you push down against the arm, and then you do the same maneuver with the thumb up, push down, and if there's pain with the thumb down that's relieved when the thumb is in the up position, that would be suggestive of a labrum tear. I must tell you that the examination of the labrum is very difficult, and these tests are not highly reliable, but they can be helpful.